Our philosophy here at Kadlec is that although I carry the title of infection preventionist, our intention is that every practitioner that involved directly with patient care or even indirectly understands that they are truly the infection preventionists.
Our patient advisory council that met, they're our customer. They're the ones that we have taken care of historically and will take care of in the future. Find out from them what is that they need from us.
The biggest aha moment that we found was that they didn't realize that the gel dispensers that are all over the hospital, like every 30 feet, they didn't realize those were for everybody to use. They thought they were just for staff. And so that when they were visiting or when they were here as patients, they didn't feel free to use them, and they didn't.
It's very interesting. The staff felt that they were providing the education needed to our patients about hand hygiene, but our surveys that we took out to patients and asked them about hand hygiene were very mixed. Some felt that they hadn't ever been told about hand hygiene, so it gave us a good reminder that we often need to educate our patients, re-educate them frequently, because hearing it once is never enough for our patients.
Some of the changes that we made based on the feedback we got from our Patient Advisory Council was to start looking at ways that we could get the information to them when they first walk into the door. So we created a couple of banners that are in our two main entrances that are about, 7-8 feet tall, and they say, "Welcome visitors, we're glad you're here. Please help us keep our patients safe by cleaning your hands before and after you visit."
We worked on introducing our patients to hand hygiene on admission. So as part of our admission process, we included that in our patient education at that time, showed them how to wash their hands, and gave them the tools that they needed to do that.
And our best interventions that we can implement come from our frontline staff. And what they see needs to be done, and we empower them and give them the resources to complete what they believe is best.
Well, we have a daily huddle every morning before rounding with our physicians, and we go through a lot of our daily management system issues, and we introduce the hand hygiene into that huddle, and every day it became a big thing. Don't forget your thumbs.
We also created or brought in little towelettes to put on our meal trays so people could actually wash their hands before they ate. Novel concept. And we also started to label our dispensers so that visitors and patients would know that they're welcome to use our hand hygiene dispensers. As far as words of advice, I'd make sure that you have the right people at the table to start the project. We had a pretty small group to start with, and that was very challenging. So if we had brought maybe a few more staff members and different disciplines into the group, we may have had more traction.
I think it's making a pretty big difference, especially with the sanitizers on the tray. I think that's the biggest thing that not only the family but the staff is really excited about, washing before you eat.
I think the difference that we'll see is going to be long-term, especially as we're continuing to integrate it throughout the rest of the hospital units. I think we'll see an increased understanding of the family members and of the patients to know not only that it's there for them, but they should be using it. It's not just a right, but it's a responsibility.